In Tan's book titled Counseling and Psychotherapy, A Christian Perspective, he writes, theory plays an important role in guiding the counselor or therapist in helping clients. A very straightforward statement, but it does nonetheless sum up why theory is so important, and that is to help the client. And so when thinking about the three areas as to why theory is so important, and through the reading as well, through this book and through our other course textbooks, there's three areas that come to mind. And so the first one kind of comes to mind is diagnosis or diagnoses. So trying to find a theory that's going to work when you're getting to know the client, you're going through the psychoeducational portion of interacting with the client and getting to know their background and their history, and then eventually kind of getting more into the deeper parts of why they're in session. And so finding out what that diagnosis or diagnoses are, not necessarily that it has to be a mental illness per se, but rather just a diagnosis, perhaps an adjustment disorder, or they're going through divorce, or there's some kind of life transition, but just knowing the core issue, the reason as to why they're coming into counseling, and then knowing what theory to then bring into that. The second is the treatment plan. Knowing first what the diagnosis is or diagnoses then sets you up to allow you to know what kind of treatment plan to formulate for this specific client, which then brings me to the third point, and that is ultimately the client. And so we as counselors can sometimes think that any theory can work with any client in any kind of situation, in any scenario that they're going through or walking through, when reality is theories are not a one-size-fits-all. And in our reading, we see quite a few different theories that are listed. In Tan's book, we see person-centered therapy, we see existential therapy, we see gestalt therapy and reality therapy, behavior therapy, just a multitude of different therapies, psychoanalytic therapy. And knowing how to utilize these therapies is so important, because the wrong therapy, the wrong theory could really ultimately be a detriment to the client and to the therapeutic relationship, and ultimately to their journey towards healing. And so knowing, one, as a counselor, and having that in-depth understanding of what each of these theories are and what they consist of and how they help, like solution-focused therapy, and even looking more further into cognitive behavior therapy and dialectic behavioral therapy, and just all of these different ones, depending on what the client is coming in for, all of these are not going to be relevant to them. Therefore, they're not all going to be beneficial to getting them to that healed state. And so knowing first what the diagnosis is, we need to then know, okay, what theory is going to work for that. And so if a client is coming in, maybe the client is an adolescent individual, male or female, they're coming in with anxiety, depression, or maybe even some kind of behavioral type of issue that they're battling, we know that DBT could be a really good therapy or a really good theory to utilize, because of the background of DBT and knowing how hands-on it is and knowing how in-depth it goes of working with the different types of behaviors and just the anxiety and the depression that comes into that as well. If we have a client coming in whose situation is a life transition, and maybe they're kind of at a fork in the road and they don't know which way to go, and they're just looking for some kind of direction or answer, we might think solution-focused therapy would be a really good one. And so knowing first what they're coming in for, but then second, knowing what theory is going to be applicable to that particular reason. And then, of course, treatment plan, we need to know what theory, because the theory is going to kind of be the framework for which we create our treatment plan. And so if we're doing solution-focused therapy, we're going to want to create a treatment plan that surrounds that, that embodies that, and has those goal-oriented facets within the treatment plan. But then ultimately we want a theory that's going to benefit the client. And so if we're just slapping on solution-focused therapy for a client who is genuinely battling bipolar disorder or deep depression. This is not going to be ultimately helpful and get them to that healed state quickest. And so those are kind of the three core points that come to mind, and that I think are very important as clinicians for us to keep in mind, that there's multiple facets that we're working with when we're one-on-one with a client or working even with a family. And so that's what I came up with as far as my 3 points, and just the importance and in general of why theory is so necessary for us to bring into the sessions. And as Tan said in his book, it's for the client, and that's why we do what we do all the time in every session. It's for the client.